This video will show you how to draw up medication and add to your home pump. Mixing medications for adding to your home pump is safe with proper instruction. Watch this video as many times as you need and encourage your caregivers and family to watch the video with you. Your nurse will visit weekly and additionally as needed for catheter dressing changes and any labs that your healthcare provider has ordered. The nurse will also tell you how to store your medication. If your medication needs to be refrigerated, it will be important to rotate your doses and use the doses in the order that they were received. Plan to remove the medication vial and medicine ball from the refrigerator 4 to 6 hours before your infusion or as directed on the label. Infusing cold medication will not hurt you, but it may feel a little uncomfortable. Never speed the warming process by microwaving or heating the medication artificially. If you forget to take your medication out of the refrigerator, it is still okay to mix and infuse. You should not change your scheduled dosing times. Hand hygiene. Wash hands thoroughly using soap and water for at least 20 seconds. Prepare a clean workspace. Clean the surface with the bleach wipe or disinfectant wipe. Allow to air dry. Gather your supplies. Vial of medication, vial of liquid to mix with, syringe with needle, medicine ball, alcohol prep pads, sharps container, saline flushes, and heparin if ordered. Compare the labels on the medication vial and medicine ball to make sure that the name and date of birth are correct. Verify the correct volume and amount of medication. Also, check the discard date to make sure that nothing has expired. Inspect the medicine ball to make sure the fluid is clear and there are no floating specks or leaks. If you see particles in the medicine, use a different medicine ball and let your nurse know. We will begin by mixing the medication. Wash your hands for at least 20 seconds with liquid hand soap and water or foam hand sanitizer. Remove the plastic caps from both vials. Use a separate alcohol wipe to clean the top of each vial, wiping in one direction 10 times and then let air dry. Remove the syringe from the package, tighten the needle, and pull the needle cover straight off. Pull the plunger back to draw air into the syringe. The amount of air should equal the amount of liquid you need to draw up to mix your medicine. Insert the needle into the vial of liquid. Push the air into the vial. Keep your thumb on the plunger of the syringe and turn the vial upside down. Pull back on the plunger to draw up the liquid. Tap the syringe to move any air bubbles to the top and push them back into the vial. Be sure to keep the needle tip in the liquid as you pull back on the plunger slowly to draw out the correct amount. When you have the correct amount drawn into the syringe, carefully remove the needle and syringe from the vial. Insert the needle into the vial of powdered medicine and inject the liquid slowly down the inside wall of the vial. Keeping the needle in the vial, carefully swirl the medication to mix it. Gently mix until you cannot see any more powder and the liquid is clear. As you did before, turn the vial upside down and pull back on the plunger to draw up the correct amount of medication. Tap to remove any large bubbles. It's okay to have tiny bubbles on the inside of the syringe. Remove the needle and syringe from the vial. Carefully put the needle cover back on using one hand in a swooping motion to prevent a needle stick injury. Set the capped syringe on your clean working area. Remove the cap from the ball on the opposite side of the tubing. Place the cap on a fresh open alcohol pad. Clean the port on the medicine ball with a new alcohol pad for 15 seconds and air dry, making sure that nothing touches the port opening. Twist the cap needle off the syringe and drop into the sharps container. Twist the tip of the syringe with the medication into the port on the ball. Push the plunger on the syringe to inject the medicine into the ball. This may require a little strength as the medicine ball is pressurized. Remove the syringe and replace the cap on the port of the ball. Roll the ball gently with your hands and inspect to make sure that the infusion fluid is clear and there are no floating specks or leaks coming from the tubing. If you see particles in the medicine or any leaking, call Fairview Home Infusion to notify a pharmacy team member. Do not use. If you have a clamp on your line, open it now. Scrub the end cap with a new alcohol pad for 15 seconds. Flush the line with saline using the push-pause method. Remove the clear winged cap at the end of the IV tubing on the medicine ball. Twist to connect to your line, and open the clamp on the medicine ball to begin your infusion. Check the medicine ball periodically to ensure it is infusing. When your infusion is complete, your medicine ball will be completely deflated, looking like this. Prepare for disconnection. Wash your hands for at least 20 seconds with liquid hand soap and water or foam hand sanitizer. Close the clamp on the IV line. Disconnect the tubing and medicine ball. Always make sure that the end cap stays attached to your IV line. Scrub the end cap with a new alcohol wipe for 15 seconds. Flush with saline using the push-pause method. If heparin is ordered, scrub the end cap with a new alcohol wipe. Flush with heparin. If your line has a clamp, close it now. Discard all used supplies in the household trash. For specific instructions on infusing medication with your medicine ball, check out the video on our YouTube channel. Reasons to call Fairview Home Infusion. If you see floating specks or particulate matter in the medication, if your dressing is peeling off or gets wet, if you notice that your tubing has migrated or moved, if you are experiencing any problem, please call 612-672-2233 if you have any questions or concerns while mixing or administering your medication. We have specialty pharmacists and nurses on call and available 24/7. In the event of an emergency, always call 911. Thank you for watching this Fairview Home Infusion educational video. We welcome your feedback. Please like this video and leave a comment below.